I am Dr. Mahesh Balsekar, consultant pediatrician at SRCC Children's Hospital, managed by Narayana Health. Once the summer ends, we all welcome the monsoon with the cooling in temperatures. But with the monsoon, there are special challenges for health in children. So what are the precautions we have to take? The most important is waterborne infections. Children are prone to acute gastroenteritis, that means diarrhea and vomiting. They can also get dysentery, that means loose motions with blood and mucus, and you can get viral hepatitis, that is jaundice. The way to prevent these infections is by taking care of the water. So it's extremely important that the water that children drink should be safe. The ideal way is to, of course, boil water, but if that is not practical, it is reasonable to use filtered water. To prevent these problems, it's very important that you take special care when you eat street food and food outside the house. The second set of problems which children face in the rains is respiratory problems, and this includes normal viruses like the common cold or rhinovirus, but more important, we get a lot of swine flu or the H1N1 or the influenza viruses. These look like the common cold, but they typically come with high fever, severe body ache and a bad cough. How can we prevent these respiratory infections? The most important is to teach children a respiratory hygiene. This means that whenever a child is coughing, the child has to cough in the elbow so that the germs don't spread, or they can cough into a tissue and then discard it and sanitize your hand after the child has coughed. Children can be prevented from getting influenza by taking the influenza vaccine. This is routinely recommended under 5 years of age. Over the age of 5 years, it is recommended for children who have underlying conditions of asthma or heart disease. The third set of problems which you see in children is mosquito-borne infections. And mosquito-borne infections include malaria, dengue fever and chikungunya. Malaria we are all familiar with, and also dengue. Chikungunya comes with high fever with severe body ache and joint swellings. It's important that we take care to prevent mosquito bites during this season. This includes the safest, of course, to have nets, but if that is impractical, when children go out during the day, long sleeved cotton clothes is important. Mosquito repellents are permitted over the age of 5 years, but if you use them when you come back home with the children, it's best to wash them off. There are many mosquito repellents which are available. Most of them have alethrin or some citronella compound. The citronella compound are probably slightly less effective but safer. The patches which you put on the clothes and bags and on the clothes, these are not very effective. Similarly, the hand bands and the wrist bands which you use are not very effective. The vaporized mosquito repellents are somewhat more effective. The citronella there is safer than the alethrin containing compounds. Those who use the mosquito coils which have smoke, this has particulate matter, and it's best to avoid prolonged use, particularly in indoor areas. And the last problem which you see in the monsoon is skin problems. Because of humidity, children are prone to skin infections and particularly fungal infections. So it is important that children's skin should be kept clean and dry during the monsoon. With these precautions, children are free to enjoy the monsoon and all the fun that it brings to their lives.